Why do you think our healthcare system lack nutritional information from the hospitals, the doctors, and the physicians? Who's benefiting from all that?
You would never design a system. You'd never come down, as an alien, come down to Earth and see 80% of adults having obesity or being overweight, 50% diabetes or prediabetes rate among adults, 93% of Americans metabolic dysfunction, which is driving 90 to 95% of all healthcare costs, 8 out of 10 leading causes of death. You'd never say, let's wait for everyone to get sick and then give them an incremental pill. One thing I'd push on a little bit is that I think we put nutrition and lifestyle habits in this niche preventative box. When my sister, Dr. Casey Means, was at Stanford Medical School, and a patient with debilitating migraines and depression and hypertension, she mentioned maybe they should look at their diet. The attending surgeon said, "Don't be a pussy," and said, "We did not go to nutrition school. We do serious medical interventions here, which is through a prescription pad or through a surgical intervention." That is the predominant mindset in American medicine, right? Doctors aren't nutritionists. There's 90% of doctors graduate without one nutrition class. 80% of med schools in the United States to this day, Stanford, Harvard on down, don't require a single nutrition class to graduate.
That is scandalous. But
it's scandalous.
This is where it points to something other than evil. This is just moronic.
Well, I think the system is evil. I don't think the dean of Stanford Medical School is evil. Right, but when Casey was there, the dean of Stanford Medical School was a pain specialist, Dr. Pizzo, and the lifeblood of medical schools, right, is funding and research funding, and the vast majority of that comes from pharma. So when he was dean of Stanford Medical School, Dr. Philip Pizzo, he accepted a multi-million-dollar donation from Pfizer and other leading opioid companies, okay, and they built a new center, and then he was appointed to the NIH panel to make, in 2011, I believe, opioid guidance. And he appointed 90% of the people that he brought on that panel also had conflicts, not just with their research funding, but personal consulting payments from opioid companies. And they created more relaxed opioid standards. And today, when you hear about the opioid crisis, 80 to 90% of people that overdose and die from illicit opioids, that started with a legal prescription pad. So it's all very nice, but that's how the system works. So is Philip Pizzo, who's still at Stanford, is he a terrible person? I don't think so, but I do think it's a lack of moral clarity and frankly a lack of leadership that they don't call this out. I have talked on this journey to leaders at Harvard Medical School, to leaders at insurance companies, to leaders at pharmaceutical companies. They're aware of what's going on, but there's plausible deniability for everyone in the system. So I do actually think, and I'm advised, everyone likes their doctor not to attack doctors, and I think doctors by and large are doing great work on an individual level and trapped in a bad system. But I will say this, I think anyone smart in these systems, I think understands what's going on. And it's not, just going back to what you said real quick, it's not that we need to stress, I don't like this bucket of prevention.
That's interesting.
Food is the best reversal. It's the best reversal. So let's just take
an ounce of prevention is worth a pound of cure.
But I think we put food in this niche. It's very important for prevention. We should be, if we were creating our healthcare system from scratch, we'd be paying.
You just want them to also use it instead of drugs for curing something.
I'm asking the medical system to trust the science. Take somebody with Alzheimer's, take somebody with depression, right? Take somebody with other conditions. Let's take those one by one. Alzheimer's is now called type 3 diabetes.
Amen.
The end of Alzheimer's, a lot of research coming out of major universities, by far
diabetes
the most,
of the brain.
Efficacious way to reverse. You can actually reverse dementia is a rigorous food and lifestyle intervention. And a lot of people in the medical system throw up their hands like nobody's going to do that. No patients are told that. I have yet to meet a person whose parents are dealing with Alzheimer's who's even been mentioned that from the doctors. It's not in the standard of care. We propel government money, tens of thousands of dollars, if not more, per patient, per Alzheimer's patient. We could pay those patients to exercise. There's public policy means to promote what is the best medicine. Depression, 150 minutes of moderate exercise, zone 2 exercise, light exercise, for 3 months consistently, 150 minutes a week, is according to peer-reviewed academic studies, is more effective than SSRI, the leading antidepressant, with less side effects. Psychologists aren't telling that to patients.
Your mission is achieved.